very little. And if circulate, or rather blood can't get through it, you can have a heart attack. That's what heart attack usually comes from. In other words, denying a certain part of the heart muscle oxygenated blood. So what we do is we don't clear out the blockage. Usually, we do it. Well, actually, we do it more now because we have stents. Although there's been a lot of problems with stents. Stents are like mesh structures that we stick into a vessel and it holds it open. So if you have some material in there that's a plaque that's causing an occlusion of the vessel, we actually send a balloon in there. We blow the balloon up. That's called angioplasty, and we push the stuff into the walls of the artery, and then we'll stick a stent in there, which will hold it open. We don't like to clean the stuff out because if something breaks loose, it'll pass along. But a lot of times we don't even want to do that. There's a lot of controversy as to which is better, angioplasty or bypass surgery. Bypass surgery is we don't want to touch the area that's getting clogged up. So what we do is we take usually the great saphenous vein, pull it out of the leg, and we clean it out in a nice little bucket. And then we cut off a piece we need, and then we sew it in before the blockage. We go around the blockage and we sew it in. So we never touch the place where the blockage is. We bypass it. That's what's called bypass surgery. And all we're doing in bypass surgery is increasing collateral circulation. Increasing collateral circulation. Okay, so here's the femoral vein, femoral artery over here. We already went through these. What else can we see? Well, these are our familiar stuff. This, of course, red vessel here, or all these red vessels are branches of what? The pulmonary veins, right? They're red. Remember, in the pulmonary circuit, arteries are red. Why? We're taking, I'm sorry, arteries are blue because we're bringing unoxygenated blood to the lungs, and oxygenated blood is being returned to the heart. So in the pulmonary circuit, we say that the arteries are blue and the veins are red. In the systemic circuit, arteries are pictured as red and veins are pictured as blue. So these are branches of the pulmonary veins. They're taking blood back to the heart. And of course, these blue things are branches of the pulmonary arteries. And we already know what these are written in. Again, most of these are not all that wonderful to show us things. Now this is showing us the zygous and azygous and hemizygous veins. But I'm not sure exactly. I thought this was on the other side there, so I'm going to have to go look in my book. But the azygous, hemizygous, the azygous and hemizygous, we'll look at these. I'll have to go look at a picture for it, tell you which are which. Nothing else new here. The same vessels. Of course, this would be the gonadal arteries. And we're not seeing the gonadal veins coming back. This is a pretty crappy thing. Well, do we have any other things that are useful to us? No, this is not as good as the other ones. And everything on your table should be exactly the same as what's over there. So what we need to do next is to look at the cat models and not get too crazy about this. What I want you, in your lab manuals, you actually have a diagram of this cat model. And let's see what we see here. Otherwise, we can just take these, lay them down like this. This is supposed to be red, I guess, right? It's an artery, but they came out a strange brown. Of course, over here we see lumbar arteries and lumbar veins. Remember, in a cat, this would be the lumbar region down here, just above the legs. So we see lumbar arteries and veins down here. Interestingly enough, we see a gonadal vein coming in here, another gonadal vein coming in up here. I don't see the arteries. These are These things here are the actually ureters going down to the bladder. So these are not blood vessels here. Who's got a copy of the lab manual? There's the picture right there. Look at it. It's right here on page 339. Take a look at that. 339. Match it up to your model. It's exactly the same thing. There's nothing for me to tell you then. Life is good. Helps me out. And start looking at that. I know. We'll be able to look at these again next time. We want to spend about a good 15 or 20 minutes, and then you can leave because I know you're all tired. So look at the little